Hello, today we'll be discussing on how to position our patient for a lateral sinus. First, we will need to be getting our patient from the waiting room. We will need to introduce ourselves, state that we will be taking their images, and ask our patients to confirm their full name, date of birth, while simultaneously confirming their identity via their wristband, and ask about their last menstrual period if needed. Our image receptor size for this image should be a 10 by 12-inch cassette. Our image receptor orientation should be portrait mode, and our image receptor location should be at the wall bucky. It could also be done at the table bucky, but at the wall bucky would be most preferred. Our SID for this image should be approximately 40 inches or 100 centimeters. Our patient position for this image will be where we will need to have our patient erect and standing at the wall bucky. We will also need to have our patient remove any metal, plastic, or removable objects. Our part position for this will be that our patient will need to be placed in a true lateral position with their face on the side of interest closest to the image receptor, moving the patient's body into an oblique direction as needed for the patient's comfort. Our central ray location for this should be approximately midway between the outer canthus and the EAM. Our central ray angulation should be perpendicular to the image receptor. Our collimation field size should be about 1 inch margin below the mandible, but it is okay if we clip the top of the vertex so long as we do not cut off the mandible or any other anatomy of interest. Visual of appropriate marker location should be that the marker location should be visible on the top corner of the frontal bone away from the anatomy of interest. KVP range for this for a real patient should be approximately 75 kVp. Our instructions for the patient should be to have our patient hold still, not move, and not breathe. The anatomy demonstrated in this image should be all four paranasal sinuses groups that are all demonstrated. The mandible and maxillary bones should all be demonstrated, as well as all four nasal sinuses, air fluid sinus levels, and the paranasal sinuses. Pathology in this image should be inflammatory conditions of the paranasal sinuses, as well as sinus polyps and cysts. That concludes on how to position our patient for a lateral sinus.